it's a great pleasure to welcome you to the final session of 2 years with COVID-19, a tale of carrots, sticks and megaphones. So I'm a professor here at the University of Newcastle, and today I'd really like to welcome you to this seminar, and I'm really looking forward. We've got a fantastic group of experts to talk with you. I think there's going to be some controversy, and if there's not, I'll throw some in for myself. And we're really interested in pushing around some of these ideas. So this session is looking really at different responses by communities, industries and government to the second year of the pandemic. So we are at an interesting stage, I think, of course, it's been interesting all the way along, but I think we're in a particularly interesting stage with respect to all our views and thinking around the pandemic and its consequences. So today we've asked our experts to focus their thinking and the conversation around the complexity and the range of issues that are yet to be fully understood and addressed. And I think we're going to touch on issues around vaccine hesitancy, what that might be about, the kind of, do we wait and see what happens, or do we encourage a firmer hand in terms of intervention? How do we deal with the impact of good and poor communication? And, the pandemic has really, I think, exacerbated and highlighted a range of existing and created new mental health challenges. So in this final session with our expert panel, whom you'll meet shortly, we're going to talk about the importance of the role of health data, the economic implications and the future of work. And this, of course, is a very important conversation to be hosted here by the University of Newcastle as the University of and for the regions. As a group, we do, I think, very important work in understanding our regional communities. We work very collaboratively with industry and government to respond to the challenges facing the regions, not just the region in which we sit in terms of the Hunter region, but of course, regions more broadly. And the institute that I head, just shortly to be established, the Institute for Regional Futures, is really focused on this question of regions and the importance of regions, what we understand about regions and the contributions that regions can make. So we're going to focus today in this conversation on what's been achieved through research and innovation and what the pandemic tells us, I think, about business as usual, what kind of future we're going to have, and what are the significant issues and areas that remain unresolved. So it's our aim in this series to focus on and highlight gaps in the management of the pandemic, the issues of importance to discuss, the public policy responses to the pandemic, and how we, as a group of interested people and as scholars, can contribute to the current debate with relevant insights. So it's my pleasure to open proceedings today. I'd like to now hand over to our moderator, Professor Francesco Paolucci, who is the Professor of Health Economics and Policy here at the University of Newcastle, to introduce our panel and to get the session underway. So thanks, Francesco.
Thank you, Professor Ryan.
Francesco, you're unmuted, but I can't hear you. Doesn't mean that other people...
Can you hear me?
I can hear you, Francesco.
Okay. All right, so I'll proceed. So thank you, Professor Ryan, our founder of the IRF and the inaugural director. Obviously, we have come to a closure today with our webinars. Then also, the year is ending. And we thought we closed the circle by trying and focus on this very complex question of impact on health and healthcare, and obviously also on collaterals, as some refer to, and clearly we will try to discuss with our guests today the impact on the labor market and the future of work. Now, I'm very delighted I'm delighted to have this panel today of speakers, and in alphabetical order, I would say, we have Alfa D'Amato, who is the director of the activity-based management, but currently acting CFO in New South Wales Health in Australia. He has been very, I would say, instrumental, but also pivotal in the application and conceivement of ABF and ABM in New South Wales, and clearly that has been widely recognized at the Commonwealth level. And I think that experience in itself raises a lot of questions on how we're going to deal with the new world, which is, many refer to it as post-COVID, when it comes to healthcare financing. So welcome, Alfa. It's a pleasure to have you here. I'd like to welcome Professor Henry Ergas. I'm very pleased that he could make it with us today. Henry is a columnist for The Australian. His contribution to Australia, would say, and economics has been remarkable over many years since his work at the OECD in Paris before coming back to Australia and working in a number of institutions, both in the public university sector and private sector, with contribution from the telecommunication to the infrastructure and clearly to the healthcare and aged care market. So I'm honored really and pleased to have you here with us, Henry. Thanks and welcome. And then I would like to introduce you to Dr. Josh Healy. He's one of our most recent additions. Of course, COVID has kind of made time perception a bit distorted. For me, is a really newcomer to Australia, to the University of Newcastle. In fact, Josh has been in other universities, particularly in Melbourne, where he started his career. He has contributed widely in the context of understanding better employment relationships and the future of work. And obviously, he has has been very active in trying to understand that in the context of the COVID pandemic, with a very interesting publication that came out a few weeks ago. So welcome, everybody, once again. And again, thank you, Roberta. Please feel free to jump in. I will try to, as usual, to propose some discussion and questions to our panelists, starting from Alfa. Alfa, you are really at the heart of the healthcare system, and you've lived COVID firsthand. From let's say an administrative management perspective of the pandemic, and of course of the reorganization which is currently occurring. So would you be so kind to introduce us to the impact problem or the impact question to the healthcare system? What is it that we are facing really when we think about funding and reorganization in terms of healthcare? Thank you.
Thanks, Francesco, and thanks for having me. I guess, as you mentioned, I've been involved for a number of years in implementing activity-based funding, which is a national, consistent approach in Australia. And as you know, a national consistent approach works well when things are moving, if you want, according to the historical trajectory. And when things get impacted by a pandemic, and when uncertainty and volatility affects states, jurisdictions at different times, it creates certain challenges that we need to recognize and start working with our partners, in particular the Commonwealth, in determining how best we can address that through the data. So I guess that's probably one of the first challenges, that if you apply the activity-based funding, the national efficient price, how can you then reflect the true impact of COVID in the future prices? And when you then want to unpack that, I think that, again, given the states and territories that have been affected differently and at different times, there is an element that is probably due to the facts of fixed costs that have been reflected through, the fact that we had to, if you want, empty out our hospitals, redeploy our resources to other, services like, COVID clinics, pop-up clinics and the like. And on top of that, there is a new, if you want, a new cost of doing business. And I use this term loosely just to reflect the fact that no matter what, there's been a shift in a cost base that is going to be permanent. And that is probably the part that we struggle to identify and determine. One is because we're not over yet. And I think things are likely to still be very volatile over the next few months. And two is because obviously the whole system needs to be readjusted. And it's fair to say that it's likely we need to start thinking slightly differently in the way the system is geared for potentially future outbreaks. So there's some of the challenges that we face. And as I say, probably uncertainty and volatility, we lived it now for the last 18 months probably, and we managed. But providing forecasts to our treasury on the numbers that we see at the moment is a big challenge, and that is what we are currently working on very hard. I think it's also important to reflect on the fact that we've had some, if you want, good initiatives, or we experimented with our partners, and I'm talking about the Commonwealth, the private sector, the community sector, and I think that there are opportunities to reflect what worked well. And now some of these opportunities can actually help us in addressing some of the future fiscal challenges, given that no matter what, both sides of the equation, we need to start thinking about how we address some of our deficits. And, obviously not only the state deficits, but also the Commonwealth deficits. Conversations that have to be, they will be important over the next few years. So I think that's certainly what is currently impacting us, what it remains probably at the center of every conversation that we're having at the moment with our treasury and with our districts.
Thank you, Alfa. So I would like to go to Henry now. So as an observation, listening also to Alfa, so we have what we have been experiencing has been a tremendous focus on health, with a clear injection of resources, both human and capital and so on, which has been kind of unprecedented, with a lot of public support in all directions. You can think of, some refer to it, the takeover of the private hospitals, but not yet really fully utilized. The now delays in being able to sort of respond to the needs of private patients to serve the public ones first and foremost, with all sorts of duplications and potential inefficiencies. So Henry, in your view, what are we going to face financially and fiscally when it comes to health and in terms of the economy as a whole? Thanks.
Well, that's a very broad question, and I wish I knew the answer to it, and I'm sure I'm not alone in wishing that we knew the answer to that question. But it seems to me to highlight both a broader point and then a number of rather focused points. I would say the broader point is that one of the questions we need to address at the moment is, do we have the institutional mechanisms in place to A, draw the lessons from this pandemic, which is not yet over, and B, to assess its long-term implications. As far as A is concerned, my own sense is that we are quite far from that we haven't really given much thought at the level of policymakers to how is it that we're going to sit back, assuming that at some point we have the luxury of sitting back, how is it that we're going to sit back and say, well, this is what we learned. This is what the surprises were. This is what the errors were. This is what actually proved to work quite well. And that's true in virtually every area. Now, in some areas, it's in the nature of things that will be done. For instance, I expect that Treasury, at least Commonwealth Treasury, will be looking at the instruments they used and the economy's response to those instruments, and trying to gauge the effectiveness of the instruments and how they might be better deployed in future. So in some areas we have that, but we certainly don't have any process that cuts across a very broad range of areas that have been affected, going from the labor market through to the health system, and thinking systematically about what worked and what didn't work. I'll give you, just if I may, a couple of examples of that. One is the emergency legislation itself. Every state and the Commonwealth had sweeping emergency powers. Some of those powers were used in ways that many people criticized. Other people thought that they worked reasonably well. Clearly, there are lots of lessons to be drawn there, and that needs to be done systematically across jurisdictions so that we can put those health management powers in pandemics on a better basis than they've had. A second obvious area where we need to think about the lessons of the pandemic, a second obvious area is whether we would have been better off if we had had a central health emergency management agency along the lines of what they've set up in the UK now, which is separate from the departmental structure and has certain powers and capabilities and resources of its own. So that's a whole series of questions that really need to be addressed. Equally, in terms of the implications, I don't think we've really yet begun to focus on that. What one can say is that the pandemic has reshaped the landscape, and so that the future will not be simply a return to the past. In the financing area, that's, I think, obviously true. We came into the pandemic with an overall fiscal improvement, certainly at a Commonwealth level and by and large at the level of the states. But the fiscal position has deteriorated very substantially, understandably so. I'm not criticizing the deterioration which occurred. I'm simply saying that it's a fact of life that we go into the future with a very large debt overhang. How we manage that debt overhang, what the implications are for fiscal policy and hence for spending, and for meeting what are still rapidly rising demands in many areas, including health and aged care, and what that means, for instance, in terms of the balance between public and private spending in those areas, all that remains to be seen. Clearly, coming to Alfa D'Amato's important points, one issue that has struck me and that I'm sure will resonate with others on this panel is the question of surge capacity. Have our financing arrangements in healthcare provided enough incentive to have the resilience needed to cope with surges and crises? And if they haven't done that, how do we do that in a way which retains the incentives to be efficient while still providing the cushion that is needed to handle both the uncertainties associated with this pandemic, which, as Alfa rightly says, is not over, okay, and the health uncertainties that lie ahead. If I may conclude with just one quote that comes from Tom Schelling, who's an economist who many of you will know, won the Nobel Prize in economics for his outstanding work. He said at one point in the preface to a book about Pearl Harbor, so this is a preface to a book about a catastrophe or a disaster, I think it's better be called, that was not properly anticipated and then had momentous and enduring consequences. He says in the preface to Roberta Wolstadter's book about Pearl Harbor, he says, it is a human trait that we tend to confuse the unexpected with the unlikely. And adjusting to that, he went on to say, is one of the hardest things to do. And that's really the challenge that we face as we come out of, hopefully come out of this pandemic and think about the road ahead.
Thanks, Harry. Yeah, very important points raised here, which I would like to come back to later on. In particular, this cushion idea, which is something that we really need to think about, because it's also probably in healthcare or in the healthcare system something that needs to materialize into something that looks like potentially a basket of services that are to be there for our systems to become more or better equipped to not only respond to pandemics and so on, but really to be more reactive and coordinated. And we've discussed this with Alfa, in fact, separately, using exactly the same word. So I'd like to come back to that. And obviously there is the key aspect in your points, try to make a connection between what you and Alfa said, that it's about the balances, and of course also the management that we decide to adopt, if we have the luxury indeed of sitting down, looking back and learn of how to rethink the balances of powers, which now seem to be sort of to have been shaken enough. But when it comes to purchasing healthcare services and having a fine, new model of healthcare delivery, properly funded with the right public-private mix, it's like the billion-dollar question on how we can practically do that, given our federal structure and the marginal role of the private, at least insurance sector. So how we can reinvent that, and probably there will be a time with these fiscal imperatives to reconsider big changes, which are not necessarily very palatable to the Australian public, or at least, since I've moved here, it's incremental change, the typical, sort of philosophy that I've seen happening, and it's quite common in healthcare anyway. So thanks. So keeping those points in mind, and to which we'll come back to, I'd like to invite now Josh, and I read your article with great interest. Obviously, we move away a bit from the immediate focus on healthcare, and we focus more about the work side of things and the future of work, and more specifically the impact of this crisis that has had on the labor markets and also on employment relations. So Josh, please guide us through.
Okay, thanks a lot, Francesco, for the introduction. So, I guess one thing about this pandemic is we've all gotten used to the watchword being pivoting, right? So here's a little bit of a pivot for you right now in this seminar. So my interest has been in work and the operation of the labour market. rather than in healthcare per se, or in the public finance sort of and issues of democracy that I suppose Henry was speaking to there. But I suppose within that, and thank you, Francesco, for kindly mentioning about that recent piece of work. One of my interests, I suppose, has been in relation to the future of work and thinking about obviously where all of that might be headed in light of the pandemic. Certainly, I'm not presenting myself as any kind of fortune teller on any of this, and you know, like with the health implications, like with the democratic and finance implications, much of this is sort of still being worked out. But I suppose what I wanted to say, I was thinking about before this session, how I would sort of organize my thoughts a little bit, and I will talk a bit to the article that I've published, but that seemed to me to be perhaps just a bit too narrowly focused. And I thought perhaps one useful way of organizing these ideas and thinking about the implications for work and the future of work would be to almost try to differentiate between what I think is happening sort of short term, medium term, and then maybe into the longer term future, as far as we can sort of bravely anticipate that at this point in time. So I want to just say briefly a bit about each of those things, and I suppose I'm happy to revisit any of this in response to further questions. On the short-term front, obviously it's been a fascinating time to watch what's happening to work and the labour market. It's been a very bumpy, sort of volatile period of time. Since the pandemic struck in Australia, essentially in the early part of 2020, we've seen the labour market go through a sort of a roller coaster ride of sorts, with precipitous downs, interesting recoveries, and then subsequent downturns again. So we know that in a period of a couple of months following sort of March 2020, employment declined in terms of numbers of people employed by about 6%, and hours went down by about 10%. Okay, so all that happened in sort of like a month and a half. It's a very sort of steep decline. Interestingly, the recovery though was also pretty quick. So, and that, at least on my reading of the data, sort of differentiates this recent period of time from earlier significant recessions in Australia. Those tended to be quite prolonged periods of recovery where it was quite slow and took in effect years to get back to the level of employment that had been prevalent pre-recession. Obviously, COVID's not over, so I don't want to pretend to be putting a punctuation mark, full stop on any of this, but it is true that after that steep decline in early 2020, by about the end of that year, both headcount employment and hours worked had nearly fully recovered to their level of sort of 8 or 9 months prior in March of 2020. So that was quite, I think for some observers, sort of quite unexpected, and obviously reflected the nature of what was going on with those lockdowns in Victoria, in particular in Melbourne. Then, of course, we sort of got back on the roller coaster and went through another sort of quite steep dip in 2021. There were, in fact, in the early part of the year, some gains in terms of employment, and then losses in the second half as prolonged lockdowns in New South Wales and then in Victoria sort of took their toll. So it remains the case on the latest data that we've got available for Australia, which is for September of this year, that in fact employment and hours worked are both still below the March 2020 levels. They're not hugely far below it, but they are still below. So in effect, we're still in a sort of an employment deficit situation, if you like. On that point about the short-term sort of changes, I think one of the most important things to stress, and I guess a matter that we'll be reflecting on, and I hope our policymakers will be seriously thinking about for some time, has been about the very uneven impact of those employment and hours losses. Okay, so it wasn't evenly shared, and in fact was quite disproportionately concentrated on particular groups, on younger workers, on workers in casual jobs, on women to some extent, and obviously on people in certain more highly exposed industries, especially in hospitality, the arts, and what we here call sort of recreation services. Okay, so it was the workers in the pubs and the cafes and the restaurants and the gyms and the hotels and so on, and the arts sector more generally that really suffered. I think sort of looking at that short-term picture, I think there's reason to at least be fairly optimistic that many of these setbacks will be temporary, and that as we wind back on the lockdown restrictions, as sort of vaccination coverage continues to rise to internationally quite high levels, we'll at least see sort of employment recover and hopefully to some extent continue to grow. The labour force participation rate has held up okay. It's obviously down a bit, but it hasn't collapsed, and that's probably a good sign of people's continuing sort of engagement with the paid labour market. One issue, of course, is around business closures. Okay, so that's a bit of a caveat. We know that in some of those sectors, businesses have taken a real hit. Small businesses have folded. Some of our high street areas are looking pretty depressed and less than their usual healthy selves as a result of this pandemic. So that will inevitably impact on the speed of the recovery. And we also know that we've driven up the numbers of people that are in sort of longer term receipt of unemployment benefit payments. Okay, so those that in effect have been claiming those benefits for more than a year. So I think that's my read anyway of the short-term picture. And then if we look, I suppose, more prospectively at the medium and long term, I think some of the medium-term issues are going to be around, first of all, the employer sort of response in relation to mandatory vaccination. We've now seen, obviously, a number of quite prominent Australian employers and organisations, some of the big banks, BHP, Qantas, and so on, big sort of private sector concerns, announcing that they're going to be requiring their workforces to be sort of fully vaccinated as a condition of their ongoing employment. That's very likely to precipitate a similar response from a whole bunch of other businesses. So how that's being worked out, I think, is an interesting medium-term issue. Already there's been, I think, what we could call a noisy minority of people that have indicated they don't intend to comply with those kinds of mandates, and they'll be searching elsewhere for more welcoming. There was a news piece just yesterday, more welcoming employers that don't differentiate between people on the basis of their vaccination status. Another issue here is obviously around working from home. Interestingly, prior to COVID-19, at least in Australia, I'm not so aware of the statistics elsewhere, but at least in Australia, working from home was never a particularly prevalent phenomenon. We'd been talking about it. Various interest groups had been talking it up, speaking about sort of technological readiness. But in around about 2015, which is the last year of data that I'm aware of, something like 7% of total working hours were done at home. Okay, so not a particularly high percentage. Obviously, that situation has dramatically changed. And I guess you can think of the pandemic as sort of being like what I might call a giant proof of concept for working from home. Many of us have done it. Many of us have demonstrated that we can be productive. Some of us have invested privately or with support from our employers in new sort of home-based equipment to facilitate working from home. So there's obviously a really interesting open question about how we're going to manage that. What kind of hybrid arrangements might employers condone? How much are employers going to insist on people returning to their previous in-person working arrangements? So that, I think, is an interesting issue. There's also interesting issues bubbling away, and perhaps I won't elaborate on this too much, but around what you might call changing expectations, particularly on the employee side and to some extent on the employer side. The argument is that a lot of people have, I suppose, reevaluated their life priorities in light of the pandemic. It's been a trying time, and that's sort of understandable. And In the US, for instance, we're seeing a phenomenon that's been labeled the Great Resignation, with a lot more job turnover. So people in the US, in particular industries especially, seem to be quitting their jobs, leaving their employment at a higher rate. And this is in a range of different outlets being attributed to sort of changing attitudes, people wanting something different from their working lives. I don't know if that's necessarily happening. There's a healthy debate going on about that, but I think that's a really interesting sort of live medium-term issue about the extent to which people are basically going to be happy to return to some version of what they had before, or whether, I think as Henry rightly said, things are going to look different on the other side of COVID-19, including in relation to how people approach their working lives and the ways they seek to find fulfillment or find a balance with their non-work priorities through that. So that's medium term. And then longer term, just very quickly, if you'll indulge me, longer term, I think as the immediacy of COVID's threat recedes, to some extent, I think the trajectory of the future of work sort of circles back to deeper, longer term issues that precede the pandemic and that have been bubbling away under the surface while we're all sort of desperately preoccupied, rightly so, with managing the COVID crisis. And the things I'm thinking of, I suppose, are demographic concerns. To what extent in Australia, obviously, we've been very reliant on a migrant workforce, temporary migrants, to fill skilled vacancies. How much of that will return as borders reopen? We've still got an aging workforce. Many countries, advanced economies around the world are facing that same issue. We've still got to manage the consequences of that. We've got new business models, of course, coming through. So to what extent are we going to continue to see that? Like I'm thinking here particularly of platform-based models like what Uber does, like what Deliveroo, Foodora, and other companies of that kind do. To what extent are we going to see that kind of business model spreading its tentacles out into new areas of work? An interesting development has been around the uses of those kinds of organising models in healthcare and social assistance. Okay, so that represents, I think, an interesting longer-term issue. And then just, I suppose, technological advances more generally. We were thinking a lot in the future of work debate prior to COVID about automation, job destruction, prospects of job creation. And in that paper that I recently published that Francesco mentioned at the top, I suppose we reflected there on some implications of that technological frontier relating to issues like collection of data on employees while working at home, issues of surveillance and privacy. And we also touched on the possibility of using new technologies like machine learning technologies to monitor issues like underpayment of wages and compliance with minimum employment standards. So I think all of that stuff will kind of come back into focus more urgently as hopefully, we're all crossing our fingers, the immediate threat of the pandemic starts to sort of taper off. So thank you for that. That's where I'll leave it for the time being.
Thank you, Josh. I would like to go back to Henry for a second on I would call it the labor market situation, its interaction with the global dynamics, which clearly show inflationary pushes everywhere. Of course, Australia has a particular setup in this moment, which has raised some eyebrows when we look at the property market trends and the stagnation of salaries by and large. So what are your thoughts, Henry, in terms of our recovery, I would say, and also if you could comment on some of the key strategic sectors that have been mostly affected, including education.
Thanks, Francesco, and thank you, Josh, for that very interesting overview of the issues that you've been examining in the labour market. I think Josh correctly highlighted the major trends that we've experienced and some of the issues that are still open and some of the uncertainties that we certainly that we will have to face going forward. In some respects, as Josh put it, this has been a very unusual crisis for the labor market. Normally, when we have recessions, it's because underlying economic fundamentals are out of kilter. In a sense, put in the jargon of economics, relative prices are wrong and macro policy settings are flawed. And because those fundamental elements are, in one respect or the other, misaligned, it takes a long time for them to move back into alignment. And so the recovery process tends to be very slow as relative prices have to change and macro settings have to adjust. And the adjustment process itself imposes costs above and beyond the costs that come from the initial misalignment. And that's really what Josh was referring to in terms of the signature that employment crises typically have, the long-term effects that they typically leave behind. But this crisis was different because, in essence, to use a healthcare analogy, what happened in this crisis was that governments, in effect, put the economy into an induced coma. And they put it into an induced coma so as to allow other things to happen, and in particular, so as to reduce the risks of infection and contamination and wait until we could, through vaccination or through development of cures and treatments, that we could come out of the danger zone that we were in as a result of the global pandemic. And so what you would expect with an induced coma, or what you would hope for when you put a patient into an induced coma, is that there isn't too much long-term damage to the patient, and that the patient can, one way or the other, be brought out of the induced coma more or less whole. But what's actually happened, and I liked Josh's term for it, is that whilst that's been by and large the case, there has been some enduring damage. So how much is very difficult to say at this point. But also there's been this massive natural experiment. And this massive natural experiment will change the way things are done in future. Now, Josh was absolutely right that that massive natural experiment, which has lots of lessons in it, that natural experiment superimposes itself on longer term trends. Clearly, one of those trends is the underlying demography of the Australian and labor force, and of the labor force in other advanced industrial countries. And there is I think, plausible argument which has been put, particularly by Charles Goodhart, a distinguished British economist. But the essence of his argument is that the combination of demographic trends in the advanced industrial economies, and particularly in China, that the combination of those demographic trends, which sees a very marked slowdown in labor force growth, which is already beginning to bite, that will, combined with the monetary policy settings that have now really become pretty much part of the landscape, that will herald a period of renewed inflation. And so that we are going from a situation where the inflationary pressures had largely disappeared, and in fact, where many central banks were worried about deflation, to one where we will have this combination of fiscal overhang or sharp fiscal constraints with potentially renewed inflation, not necessarily at quite the levels that we had in the 70s and 80s, but nonetheless, a marked reversal of what there has been to date. And that inflation will not solely be in asset prices, which is really what we've had since 2000 or so, since 1998, really, 2000 on, will not solely be in asset prices, but will also be in the labor market. In other words, we'll see a renewal of wage pressures, which had largely disappeared. Now, that in turn will obviously have very significant implications for those parts of the economy that are relatively labor intensive. And a lot of our labor force growth in recent decades has come in areas, in the service areas of the economy where labor intensity is more or less a fact of life, and where the scope for capital labor substitution has been reasonably limited. Now, there are areas where that's not true. It may be that that will change with automation. It may also be that other innovations can help reduce the pressures. But what that means, I think, for areas like health and aged care, okay, is that they will face a very significant challenge going forward, because essentially what will have to happen is we'll have to somehow build in the surge capacity that we will clearly need in future. Okay? So we'll have to do that. At the same time, we will have fiscal constraints, which mean that the pressures to squeeze costs and secure efficiencies will be as great as ever. And yet we will face labor force issues that will be very hard to manage. Indeed, in aged care, they are already at crisis point. Right? And so how we handle that perfect storm in the changed world that we face post-COVID is, I think, an immense open question that I imagine people like Alfa are spending sleepless nights over. My fear in all this, and I come back to a point that Josh made, is that we will make the mistake of forgetting too soon. Right? There's a human tendency when you've had a trauma, you go through phases of grief, and I'm by no means an expert on that. I'm sure all of you know much more about it than I do, but you go through stages of grief, and at some point you put it behind you. And in Australia, we're extremely good at that. Right? We're very good at remembering what we should forget and forgetting what we ought to remember. As this crisis too comes to some kind of resolution, we need to build in institutional memory that will allow us to then address these big questions that we still have to face.
Thank you, Henry. Yeah, exactly where we wanted to be at this hour, I would say, and go back to Alfa. So the perfect storm. It couldn't have been described better. And I think in healthcare, we've kind of watched it for a while. And you can take the labor market and its rigidities or lack of contestability as one important barrier for basically being able to manage the problem we're facing, without being too technical, but let's say a bilateral monopoly that clearly has its own problems, and clearly puts already in itself in a market that it's arguably difficult to see as productive, in terms of labor productivity. Very hard to measure, very hard to observe it in healthcare. Having this infrastructure underneath framework puts pressures on ultimately prices that we've seen in Australia. Alfa has been dealing with this really in an excellent way in New South Wales, although we've seen growth, in particular if you look at states like New South Wales that has a mix between city and rural areas. So how to serve the rural areas, what's the cost of that? We've seen the prices really of care going up. And I think what Henry pointed at is that these pressures will be even greater. And clearly, one is tempted to say, Alfa, and I will try to pick your brains on this. Why don't we break and that's easy said, right? Why don't we break the current vicious circle and think of more contestable models? What do you see as the opportunity there with this crisis, and also the challenge, Alfa?
That's a good question, Francesco. I think that I like the analogy of the institutional memory, and you're absolutely right. We need to kind of stop, if you want to stop and reflect on what has happened, what worked and what didn't work. And I think that the labor market for us has always been an issue. It's been challenging us for many, many years. We have a cost base that takes around 70% to wages. So, and on top of that, the workforce is, as you know, the medical workforce, the clinical workforce is highly dependent on skilled migrants. So I kind of guess that is on top of all the fiscal constraints, the inflation pressure, all of these for health is probably a bit of a ticking bomb. And with the COVID and the need to build the resilience in the system, it will have to start thinking differently. We need to start thinking about contestability. We need to start thinking about how we can, I call it, plug in and play with a private sector. We've done it. We've done it twice. Most recently, in July and August, in the middle of the pandemic, where we had to then only engage with the private sector where we need the additional capacity, but we actually need the resources from the private sector, and therefore we had to take workforce out of the private sector and redeploy into hospitals, into our clinics, into our vaccination clinics. So I guess how we're going to go about this concept of contestability or thinking differently is not going to be easy, because we've been probably at that few times. But this crisis kind of given us an opportunity. And if the opportunity for us is now to reflect on what worked and try to structure a bit of a framework on what this could look like in addressing the resilience question that we need to address, this cushioning that you mentioned before, Francesco, we need to really start thinking exactly how this could be put in place. What does this framework look like? Be ready to switch on at any time. Because as I say, the pressure remains in the system. And I think, our workforce is certainly one of our biggest challenge. And despite all our effort, I still feel that there are so many different ways that we could address some of these problems. Contestability is only one. I think that the collaboration and this approach of almost like opening the collaboration with other sectors as well, not only with the private sector, but the community sector. The Commonwealth, the primary healthcare networks, the GPs, with a collaborative commissioning almost. And I think that's where we really need to start shifting and thinking fairly soon, so that we can, again, don't lose the institutional memory from the exercise that we just witnessed.
Thank you, Alfa. We're coming close to the time, and in thanking you all for your contribution, and of course to be continued, whether we like it or not. In a sense, the pandemic is still going, and it's an evolving, certainly. I would say also a continuous debate that goes on and shifts. With frequency here and overseas, and also I want to thank Henry even more because he's joining us at a very early hour. I'm not sure exactly when the time changed, but I realized this yesterday that you had an hour taken away. So I realized today that it's very early now for you. In Europe. So thank you even more for being here with us. I would like to invite Roberta to kind of bring to a closure this meeting of today. In doing that, I'd like to thank everybody, Alfa for his time and of course contribution. Henry, once again, thank you so much for being with us. Josh, very appreciate. I appreciate very much your contribution. Thank you, and also thank you for those who came. I saw a number of comments coming through, which I will direct and address after this session. So, Roberta, please, for the closing. Thank you so much.
Look, thanks, Francesco. Thanks to all three of you for a very interesting conversation. The hour seems to go too quickly, Francesco. I feel a bit sort of, like there's more to be said and more to say to each other, and of course, more to hear from participants. So maybe we need to, reconfigure this to a slightly longer conversation. But as promised, of course, it was very stimulating. I mean, the things that resonated with me are about complexity, about lessons learned. What are we going to learn? How's it going to stick? How are the things that we've experienced and learned? How's it going to stick with us in such a way that we actually reflect and incorporate some of the changes that we're going to have to do to better respond in the future. Things around, the need for surge capacity in the health system and, really significant workforce issues, which of course have existed and have just been exacerbated by this. And I can't resist as a political sociologist to say that if we really don't take the lessons from things like this pandemic, we risk embedding existing spatial inequality. And I'm disappointed that we haven't used the expertise of the broader social sciences in terms of understanding both using the predictive ability about how this infection was going to spread, and where are the areas which, of course, have been most seriously hit, which, of course, have been the poorest parts of our community and our Indigenous communities. And it was completely predictable from the beginning. And areas that are poorly serviced by health now are the places where the consequences have been most greatly felt. The exciting and interesting predictive space, in my mind at least, is the workforce issue about, how much of all this working from home is going to stick, and where is it all going to end up, and is it going to be 2 days a week, 3 days a week? What's it all mean? And all that discussion, yes, Josh, I too remember those discussions about, we have to be technologically enabled to do all this. And we basically did it overnight. And here we are running very interesting seminars in completely new formats with people from all around the world. So look, thank you to the audience for being here. Thank you to you. And Francesco, my recommendation, we've got to have more conversations. The sessions have to be longer so that we can get into the meat of this. But thanks to everyone.
As a famous paper in economics says, when talking about competition, when you try to get the right number there between 4 and 6, what's optimal? I don't know. But point taken. Obviously, we will try to make these events longer. Of course, always a trade-off. But for those who couldn't make it today, of course, this is recorded. It goes on our Value in Health Economics and Policy Group website. Clearly, stay tuned. We'll come back in the new year with new events, and of course, we'll continue this conversation in the coming year. Thank you so much, Henry, Alfa, Josh and Roberta and all of you joining us today.
Go well,
Thank
everyone.
you.
Thank you.